This video is a tutorial on how to locate and scan the appendix with ultrasound. Begin the exam by confirming the patient's name and date of birth. Make sure the machine is in the correct preset, under either abdomen or appendix. The sonographer will use a linear probe when scanning. Before looking for the appendix, check for free fluid in the right upper quadrant and the pelvis. The location of the appendix can be variable. The best way to start locating the appendix is to use McBurney points, which is 1/3 the distance between the umbilicus and the iliac spine. The location of the appendix is most commonly retrocecal, but it can also be seen subcecal, subhepatic, and in the pelvis. The normal appendix is a long, thin, blind-ended tubular structure extending off the cecum. It is located in the right iliac fossa region and is easily compressible. The AP diameter will be less than 7 mm and there will be little to no color flow with Doppler. Compressions with the transducer should be performed to help displace small bowel loops out of the way. The displacement of the bowel should allow the visualization of the iliac vessels in the right iliac fossa as well as the psoas muscle. Compressions will help determine if appendicitis is present or not. When a patient presents with right lower quadrant pain suggestive of acute appendicitis, the sonographer should ask where it hurts and start scanning at that location. An inflamed appendix can be seen 90% of the time. The patient will also have an elevated white blood cell count, fever, nausea, and vomiting. Inflamed appendix will appear as a target lesion in the right lower quadrant exceeding 7 mm in diameter. There will be increased blood flow and a non-compressible structure without peristalsis. The blind end of the appendix is easily visualized. Sometimes an appendicolite with shadowing may be seen within the lumen of the inflamed appendix. This finding is always indicative of appendicitis regardless of the presence or absence of other symptoms. Thanks for watching this tutorial.